So the Premier, as we've discussed here, says the province is about to enter stage one of the economic recovery plan. I'm just wondering from you, do you feel confident that we've met the threshold to actually enter the first stage of that recovery?
No, I would have recommended we were already there, but we haven't yet. So that's what I was explaining to the other people, that we're on our downward trend. We're in about day 7, 8 of a sort of a downward trend, unfortunately not a very rapid downward trend, but it's tending that way. Our other metrics are looking good, but we haven't had all those things come together yet where we say, now we're ready to enter stage one. I think we're getting closer in that, but if it was already there, I would have already recommended it.
Follow-up?
Okay, thank you. And just looking at other regions in the world where we're seeing restrictions that have been lifted, an uptick in new cases, and then, of course, they have to go back into a lockdown. I know that that's kind of the pattern that we could follow here, but I'm just wondering about the threshold for reintroducing measures. So once we reach stage one, as an example, I know you're going to be doing a lot of surveying to see whether COVID-19 has spread. What is your threshold for the number of daily new cases to say, okay, we need to reintroduce some of these measures?
Well, all along, as I said, when we were going back a while now, all throughout February and March, unlike some other centers, we were impacted by a lot of potential and real imported cases coming into our naive population. And then we were, with the cooperation of the people who came forward very responsibly and doing a lot of case contact management then, because then we found some individuals who had come back from country X, Y, or Z, found out they were positive, and some had been very vigilant, stayed home, did quarantining because they suspected they might have been. Others didn't even know the country came from had an epidemic going on. And some said, well, I went to this event, there's 50 people there, I went to this one, I went to that store. So all of a sudden you got 500 or 700 people to follow up. We did that with good case contact management and contained it. As a result, they could have spread really further, and we could have already been way higher numbers than we have. When we got above about 130, 120, 30 cases a day coming in, and we had that big influx from people who just came back and didn't know there was already some cases and was rising up in the U.S., the Eastern Seaboard, we soon got overwhelmed with that, and we started seeing those community spread cases where we couldn't do the epidemiological linkage. Our point will be when we get bound to that level again where we can contain it, because then if you have second waves, another one coming up, you quickly jump on and you contain that. If again you can't contain, then like you said with other countries that may not have as a robust case contact management, then they have to then revert back again and put in those measures, turn the dial back up again, put people back into lockdown, that kind of stuff, because that's your tool, the only tool you have. If you have a very aggressive and very assertive, I'd say aggressive as in not being aggressive as in angry, but as one that's very target driven, very thorough in its investigation and protecting the individuals, protecting their family members, etc., that you contain it, whether it's at a family level or a group gathering or an event, then the public at large are protected, and you don't have to reverse your public health measures. The key is you have to contain it.